Bleeding in the second or third trimester of pregnancy can be really scary, and one important cause is a condition called placenta previa. Today, I'm going to break down exactly what it is, why it happens, the risks involved, and most importantly, how doctors manage it to ensure a safe delivery for both you and your baby. So, let's get into it. First, what exactly is placenta previa? In simple terms, it means your placenta is positioned unusually low in your uterus, either very close to or completely covering the cervix. The cervix is the opening to the birth canal, so you can see why this placement matters. You might hear a few different terms from your doctor. A low-lying placenta means it's near the cervix but not covering it. Partial previa means it covers part of the cervical opening, and complete previa means it covers the entire opening. Most of the time, placenta previa is first spotted during a routine ultrasound, usually the one you get around 20 weeks into your pregnancy. A common question is, why does this happen? Did I do something wrong? The answer is almost always no. Placenta previa isn't caused by anything you did or didn't do. It just happens. However, there are some factors that can increase the risk. These include having had a previous C-section or other surgery on your uterus, a history of placenta previa in a past pregnancy, or being pregnant with multiples like twins or triplets. Pregnancies from IVF, smoking, and being of an older maternal age can also be contributing factors. Now, it's really important to know that many cases of a low-lying placenta diagnosed early in pregnancy actually resolve on their own. As your uterus grows and stretches upwards, it often pulls the placenta with it, moving it away from the cervix. So, what should you watch out for? The most classic symptom of placenta previa is painless, bright red vaginal bleeding, usually during the second or third trimester. It can range from light spotting to a heavy flow. This is where we need to talk about emergencies. You should go to the emergency room immediately if you experience heavy bleeding, like soaking through a pad in an hour, or if you feel dizzy, lightheaded, or faint. Also, if you having contractions along with the bleeding, or if you notice your baby is moving less than usual, that's a sign to get checked out right away. Please never try to do a vaginal exam on yourself at home, and never ignore bleeding during pregnancy. Always call your doctor or head to the hospital. Understandably, this diagnosis comes with some risks. The main concern is the potential for heavy bleeding, which can happen before or during delivery and can be dangerous for both mom and baby. This bleeding can sometimes lead to preterm birth, meaning the baby is born before 37 weeks. Because of this risk, you might need to be monitored in the hospital for a period of time. In some rare cases, particularly with multiple previous C-sections, the placenta can attach too deeply into the uterine wall, a condition called placenta accreta, which complicates delivery. But I want to emphasize that with good medical care and careful planning, the vast majority of women with placenta previa have safe deliveries and healthy babies. How do doctors manage placenta previa? The treatment plan really depends on a few things: how low the placenta is, how much bleeding you've had, and how far along you are in your pregnancy. Your doctor will likely recommend pelvic rest, which means no sex or putting anything in the vagina to avoid triggering bleeding. They might also advise you to avoid heavy lifting or strenuous exercise. You'll have follow-up ultrasounds to track the placenta's position and see if it moves up. If you have repeated episodes of bleeding, your doctor may admit you to the hospital for observation. If there's a risk of preterm delivery, you might be given steroid injections to help your baby's lungs mature faster. Finally, let's talk about the delivery plan. If the placenta is still covering or very close to the cervix late in pregnancy, a C-section is the safest way to deliver the baby. A vaginal delivery would cause the placenta to detach first, leading to severe bleeding. The timing of this planned C-section depends on your stability and any bleeding episodes. For stable cases without significant bleeding, a C-section is often scheduled around 36 to 37 weeks. Your doctor will create a specific plan based on your individual situation. Placenta previa can sound intimidating, but the key to a safe outcome is straightforward. Get an early diagnosis, monitor the situation closely with your healthcare team, and have a solid, safe delivery plan in place. If you've experienced any bleeding, please don't wait. Get checked out to ensure the best care for you and your little one. Thanks for watching, and be sure to subscribe for more pregnancy health info.